Hi, my name is Arbella Montero from BSN1 King.
I am Alexa Marie Leonor from BSN1 King. My name is Ina Tires Lucis from BS1 King.
My name is Precious Hermione P. Hamusin from BSN1 King.
Hello everyone, I am Jasmine H. Lester from BSN1 King. Bronchial asthma is a chronic lung disease characterized by airway inflammation and hyperresponsiveness, leading to variable airflow obstruction. This means that the airways or bronchial tubes become inflamed and narrow, making it difficult to breathe. Symptoms of bronchial asthma can vary in severity and frequency and may include wheezing, coughing, shortness of breath, and chest tightness.
Structure and function. Nose. The nose or nasal cavity provides air for respiration and serves the sense of smell. It also conditions the air by filtering, warming, and moistening it, and cleans itself of foreign debris inhaled. Air travels in and out of the lungs through the two nasal cavities. Additionally, if you have allergic rhinitis or hay fever and asthma, you may experience additional symptoms such as runny nose, nasal congestion, and post-nasal drip. Mouth. The mouth or oral cavity also brings air into your lungs. Since the mouth is larger than nose, it can bring in more air. Because the air doesn't have to travel as far as your body can use it faster. Your mouth is one of the ways your lungs can receive oxygen and get rid of carbon dioxide. You may find it harder to breathe during an asthma attack, including shortness of breath and wheezing sound coming out of your mouth. Pharynx. The pharynx or throat is a muscular tube located in the middle of your neck. It helps you breathe and digest food. Many medical issues can affect the pharynx, ranging from a common cold to cancer. You can protect your pharynx by not smoking and avoiding infection. Right before an asthma attack, you may notice that your throat feels itchy. This can cause you to cough more. If you have a mucus buildup from asthma, you may also find yourself clearing your throat more frequently than usual. Larynx. The larynx or voice box is located in the neck and performs several important functions in the body. It's involved in swallowing, breathing, and voice production. Sound it produces when air passing through to the vocal cord causes them to vibrate, creating sound waves in the pharynx, nose, and mouth. Asthma may cause vocal cord dysfunction, which can lead to cooing, wheezing, and breathing difficulties. Trachea. The trachea or windpipe allows the passage of inspired and expired air into and out of the lungs. The trachea is a midline structure located just anterior to the esophagus. After originating from the larynx, the trachea divides into the left and right mainstem bronchi. Your windpipe is a smooth muscle that plays a crucial role in delivering oxygen to your lungs. This key airway may become inflamed and constrict from asthma, leading to coughing and breathing difficulties. Lungs. The lungs makes oxygen available to your body and remove other gases, such as carbon dioxide. Bronchi. The bronchi carry air to and from your lungs. They also help moisturize the air you breathe and filter out foreign particles. Bronchial. The bronchial carry air to small sacs into your lungs, called alveoli. The alveoli are where your body's gas exchange takes place. Asthma causes inflammation in the bronchial tubes of your lungs, making them red and swollen. During an asthma attack, the muscle walls in the airway contract and the lining becomes swollen and inflamed, narrowing the airways. This narrowing is further aggravated by increased mucus secretions, which can block smaller airways, while larger airways have cartilage to prevent collapse. Smaller bronchi and bronchial lack this support. These smaller airways are muscular tubes with many mucus secreting cells in their lining.
There are usually reasons or risk factors that predispose you to bronchial asthma and respiratory problems. Bronchial asthma can happen to anyone without any risk factors, but it is less likely if there are no risk factors present. While the exact causes of asthma are not known, health experts believe that both genetic and environmental factors can contribute to asthma. What causes bronchial asthma? First, family history. If you have a parent with asthma, you are 3 to 6 times more likely to develop asthma than someone who does not have a parent with asthma. Second, allergies. Some people are more likely to develop allergies than others, especially if one of their parents has allergies. Certain allergic conditions, such as atopic dermatitis or eczema, or allergic rhinitis or hay fever, are linked to people who get asthma. Viral respiratory infections. Respiratory problems during infancy and childhood can cause wheezing. Some children who experience viral respiratory infections go on to develop chronic asthma. Environmental factors and bronchial asthma. Indoor air pollution such as cigarette smoke, mold, and noxious fumes from household cleaners and paints can cause allergic reaction and asthma. Environmental factors such as pollution, sulfur dioxide, nitrogen oxide, ozone, cold temperatures, and high humidity are all known to trigger asthma in susceptible individuals. And lastly, we have obesity. Children and adults who are overweight or obese are at greater risk of asthma. Although the reasons are unclear, some experts point to low-grade inflammation in the body that occurs with extra weight.
Types of asthma. Allergic asthma, or allergy-induced asthma, is a chronic condition where allergens like pollen, dust mites, mold, or pet dander trigger an immune response, causing airway inflammation and tightening. This leads to symptoms like wheezing, shortness of breath, and coughing. The immune system overproduces immunoglobulin E, causing the release of chemicals to worsen airway constriction. About 60% of asthma cases are allergic asthma, often triggered by environmental factors. Non-allergic asthma, or non-atopic asthma, is a type of asthma not triggered by allergens like pollen, dust mites, or pets. It is less common than allergic asthma, affecting about 1 in 5 people with asthma, and often develops later in life. Adult onset asthma, or adult asthma, develops in individuals over the age of 20. It's characterized by persistent symptoms in adulthood. In adult onset asthma, the inner lining of the airways becomes sensitive, irritated, and swollen when exposed to certain triggers, leading to excessive mucus production. Pediatric asthma, or childhood asthma, is a condition that typically begins in childhood and is characterized by symptoms such as wheezing, coughing, shortness of breath, and chest tightness, along with airway inflammation and hyperresponsiveness. The severity of this condition can vary from mild to life-threatening. Asthma in children is influenced by both genetics and environmental factors. While many children who experience wheezing before age 6 outgrow it, those with a family history of asthma, atopy, and persistent symptoms are more likely to develop long-term asthma. Exercise-induced asthma is a temporary narrowing of the airways triggered by strenuous exercise, typically occurring within 15 minutes of activity or up to 4 to 12 hours later as a late-phase response. People with EIA may experience symptoms like shortness of breath, dizziness, fatigue, chest tightness, coughing, or even stomach aches. Occupational asthma, or work-related asthma, is caused by inhaling irritants like dust, gases, fumes, or vapors at the workplace, triggering an immune response that narrows and swells the airways, making breathing difficult. Symptoms include chest tightness, wheezing, and shortness of breath. About 10 to 25% of adults with asthma experience occupational asthma, which is often reversible if the irritants are avoided. Through prolonged exposure can lead to permanent lung damage. Nocturnal asthma is a type of asthma where symptoms like chest tightness, shortness of breath, coughing, and wheezing worsen at night, disrupting sleep and leading to daytime fatigue and irritability. It affects about 75% of people with asthma, with nearly half experiencing symptoms every night. These sleep disturbances often indicate poor asthma control and can significantly impact quality of life. Asthma COPD overlap syndrome refers to patients who exhibit features of both asthma and chronic obstructive pulmonary disease, typically affecting individuals over 40. ACOS is characterized by persistent airflow limitation, a history of asthma, or bronchodilator reversibility. It impacts about 25% of COPD patients and nearly 30% of those with a history of asthma. Asthma is categorized into 4 main stages based on symptom severity. Intermittent asthma, or mild intermittent asthma. Symptoms occur less than twice a week and nighttime awakenings are rare. It has minimal impact on daily life, and lung function is normal, about 80% or more of expected. Inhalers are used less than twice a week. Mild persistent asthma. Symptoms occur more than twice a week, but not daily, and nighttime awakenings happen a few times per month. It causes slight impact on daily activities, with normal lung function and inhaler use more than twice a week. Moderate persistent asthma. Symptoms occur daily, with nighttime awakenings more than once a week. It has a moderate impact on daily activities. Lung function is reduced, about 60% to 80%, and inhalers are used daily. Severe persistent asthma. Symptoms occur throughout the day, and nighttime awakenings happen every night. It has a significant impact on daily activities. Lung function is severely reduced, below 60%, and inhalers are used multiple times a day.
Bronchial asthma is a long-term respiratory condition characterized by wheezing, coughing, and breathing difficulties. If not effectively managed, it can lead to several serious complications, including frequent asthma attacks. Asthma attacks are sudden worsening of breathing difficulties due to airway inflammation and constriction. They can be triggered by allergens, infections, or irritants. Sleep disturbances. Nighttime asthma symptoms can disrupt sleep, leading to fatigue and reduced cognitive function. Poor sleep can also worsen asthma control, creating a cycle of symptoms and sleep issues. Airway remodeling. Chronic inflammation from bronchial asthma can lead to airway remodeling, causing permanent changes like thickening of airway walls and increased mucus production. This can reduce lung function and make asthma harder to control. Allergic rhinitis. Many individuals also experience allergic rhinitis, resulting in nasal congestion and sneezing. Allergens can trigger both conditions, worsening respiratory symptoms and making asthma management more challenging. Pneumonia. Patients are at higher risk for respiratory infections such as pneumonia. This can exacerbate asthma symptoms and may require antibiotics or hospitalization if severe. Cor pulmonale. This complication refers to the enlargement of the right side of the heart due to prolonged high blood pressure in the pulmonary arteries. It can lead to symptoms like shortness of breath and fatigue. Bronchiectasis, a complication of bronchial asthma that results in the abnormal widening and damage of the bronchial tubes. This leads to persistent cough, excessive mucus production, and increased susceptibility to respiratory infections due to impaired airway clearance. Lastly is respiratory failure. It is a serious condition in which the respiratory system fails to provide adequate oxygen to the body or remove carbon dioxide. Severe asthma attacks can lead to respiratory failure requiring emergency treatment.
Pharmacologic interventions play a crucial role in managing bronchial asthma. Common medications include inhaled corticosteroid and short-acting beta agonists. Inhaled corticosteroids. These medications reduce inflammation in the airways, preventing asthma attacks. Short-acting beta agonists. These drugs relax the muscle around the airways, providing quick relief during an asthma attack. In addition to medication, non-pharmacologic interventions can also help manage asthma symptoms. These include environmental control, stress management techniques, and a healthy diet. Environmental control, reducing exposure to allergens and irritants such as dust mites, pet dander, mold, and tobacco smoke. Stress management techniques. Practices like yoga, meditation, and deep breathing can help manage stress, which can trigger asthma symptoms. Healthy diet. A balanced diet can contribute to overall health and may help manage asthma symptoms.